They're more common than you might think. But not all dark circles are the same.
That is absolutely right. We have a lot of questions. Our next guest is here to answer them for us. Poor her. I'm so sorry in advance. Please welcome skin expert and founder of Glow by Glen, Dr. Glen. Say it for me again.
Dr. Glenicia Nosworthy.
That is a fantastic name, Dr. Nosworthy.
Thank you. Thank you so much for having me.
First of all, that collagen cocktail you say.
Interesting. When I have a cocktail, I want to truly enjoy it.
Yeah.
When I go out, I'm having a good time. I don't want to drink a pair of socks.
No.
Dirty or clean.
Most
Right,
would agree
exactly.
with you, I think. And
Yeah.
by most, I mean us two, for sure.
Us too, for sure, yeah.
Okay, let's get right to it because this is for us. This is for my mother. This is for everybody watching at home. Men, women, everybody. Bobby's raising his hand. Everybody gets dark circles. Not all dark circles are the same. They all look different. Where do they come from? What is the root cause of a dark circle?
So that is a great question. There are two main categories for the causes behind dark circles. The first one is simply genetics.
I knew you were going to say that.
Yes.
Miriam.
Yeah.
Unfortunately, if your parents have dark under eyes, then you are likely to have it too. I'm so sorry for everyone who's watching and disappointed. But the second category is related to diet and lifestyle. If you are a smoker, excess alcohol intake, dehydration, if you are exposed to the sun too much without enough sun protection, if you're not getting enough sleep, fatigue.
All those things. What role do vitamins play in all of this business?
And that's the third category, medical conditions and vitamins. So medical conditions, metabolic conditions such as diabetes, thyroid disease, all of those can cause dark under eyes. You also have anemia, which is a deficiency in iron, but also you can become anemic by a deficiency in B12.
Right. Yeah.
Then the other vitamins, such as fat-soluble vitamins, your vitamin A, D, E, and K, all of those contribute to dark under eyes.
We can't win Fallujah.
So is it like a lacking? Just to put a bow on that, it's a deficiency in those vitamins.
A deficiency because they're very important in the building blocks of collagen and elastin, which is why drinking collagen is not as effective. You have to build it. Your body has to build it.
How do we do that?
Yes.
So, as I'm an internal medicine physician, I own an integrative medical practice. So when I look at beauty from the inside out.
Yeah.
And nutrients is a vital part of beauty.
Right.
If you're nutrient deficient, it's hard for you to have the nutrients that your cells need in order to create collagen, elastin, and these proteins. So you need a good variety of vitamins, especially the ones that I mentioned, your fat-soluble vitamins. Right. You also need amino acids, your proline, your lysine. These are the amino acids are the building blocks of proteins. And proteins are what make, that's the elastin and collagen. Those are proteins.
Okay.
So it's really important to have that combination. It's for those micronutrients.
To build this. Not all dark under eye circles are built alike. There are 4 different types. Can you tell us? Yeah.
So there are 4 different types, but I actually break it down into 3 categories.
Okay. Sure.
My first category is hyperpigmentation. And that's usually when you have more brown darkening under the eye. And this is caused by an overproduction of melanin.
Okay.
It's more common in darker skin types, and it can be genetic or acquired. When it's acquired, it's usually because of the sun exposure.
Okay.
Your second type is vascular. Vascular is caused by just simply being able to see the veins under the eye through thin skin. It is usually your bluish or purplish in color, and it's more common in individuals of a lighter skin tone.
Okay.
And the things that can cause that are activities or lifestyle activities that cause vascular damage, such as smoking and drinking, the common ones.
The common ones, okay.
Then the third category is it's structural. So the people think wrinkles is a category, or hollowness is a separate category, but I put them all under structural because this has to do with the architecture of the skin and the structures under the eye.
Okay.
So your hollowness creates shadows, and then those shadows, in combination with some wrinkles, can contribute to dark under eyes.
How do we get rid of these suckers? What are we doing here?
Yeah, so there are many things that are available and on services I provide and many other doctors provide that can help to get rid of dark under eyes. For hyperpigmentation, once you know the cause, then you know how to treat it. So if the cause is overproduction, then you need to decrease the production of melanin and help lift the pigment. Okay. You can do that with topicals such as hydroquinone, tranexamic acid, kojic acid. Yes.
Okay, and then how about for the vascular and then the structural?
So for vascular, I approach this in 2 ways. Because you're seeing the vessels, you want to basically do things that are going to get those vessels to constrict. Because when they constrict, that pushes the pigment forward and away from the under eye, so that way they're smaller and less visible. You can do that by using caffeine or cold eye patches.
See,
this is what I do every morning.
There is some truth to those eye patches,
yes.
okay?
And then how about for the structural?
For structural, you want to rebuild the architecture of the skin. So dermal fillers are good for the hollows, as we all know. And then you have things like platelet-rich plasma, platelet-rich fibrin that help to stimulate growth factors and collagen.
But this is something that we go into the
This
office
is a treatment.
and get done.
Because you say platelet-rich plasma, I think like microneedling with PRP. Would you do that to the under eye?
Yeah.
Okay.
So you can do it topically. You can do it with a
In the
treatment.
office?
Some of us are born with it. Some of us acquire
Now,
it.
if it is genetic, obviously, you know, they say look at your parents, and that's a peek into your future. Are there ways to any of these things that you've talked about now? Can we do this to maybe reduce? Obviously, that's kind of going to be with aging what we're fighting here. But is there a way to kind of have a control on it with any of the aforementioned treatments?
So the way to best control, because everything is nature versus nurture, your DNA versus what you expose yourself to and how you take care of yourself. So I like to look at beauty in 3 main categories. The first one, sun protection. UV rays ages your skin. We all know this, but we don't all use our sunblock. So we need to use that.
Yes.
The second thing is having a great skincare regimen. Things like hyaluronic acid and ferulic acid and serums that have antioxidants in it, vitamin B, vitamin D, vitamin E, that helps you to not deal with or absorb the effects of the harmful sun rays.
All right, brass tacks, what do you do? Because I want to just look like you.
Yes, your skin is fantastic.
And don't tell me I have to die and be born again.
No, not at all. Besides those first 2 things, I'm very, very adamant about my nutrients, my micronutrients. So
this is what you're
putting in your mouth.
Everything everything that I'm saying to you guys is exactly what I do. So I take really great supplements that it's very rich in B vitamins, minerals, antioxidants, amino acids, and my goal is to keep my skin looking as youthful as possible forever.
She's actually 129 years old.
We're out of time, unfortunately. We know we could talk about this rest of the show. We're going to have to take this offline.
Thank you so much.
Dr. Glenicia Nosworthy.